Hi, we're going to go over the Administrative Dental Assistant book today, Chapter 1, and we're going to start at page 11 where it says Professional Ethics. So, both laws and ethics have to be observed in the daily operation of a dental office, is how it starts. Now, what are ethics? So, ethics are going to deal with your moral judgments as determined by a professional organization. So, laws are something that we must do, we must follow the speed limit. We must pay taxes. Those are laws. Those are things that we must do. Ethics deals with moral judgment. So with those moral judgments, it is what should you do. So that is the difference between a law, a legal decision, and an ethical decision. A legal decision deals with what you must do, an ethical decision deals with what you should do. So there are times when law and ethics do come into conflict with each other, but this chapter is going to go over all of that. So with the ADA, which is the American Dental Association, it gives the states the right of self-government, and that's a privilege and an obligation. So each state is governed by state rules as well as federal rules, and they must follow those legal boundaries. But with ethical boundaries, let's talk about the principles of ethics. In the American Dental Association Principles of Ethics and Code of Professional Conduct starts on page 11, and it believes that dentists should possess not only one skill and technical competence, but also those traits of character that foster adherence to ethical principles. So those kind of traits that they're looking for would be honesty, compassion, kindness, integrity, fairness, and charity as part of the ethical education of a dentist. We're going to go over each of these ethics further. So in section 1, they go over the principle of patient autonomy or self-governance. So we have the autonomy or the right to govern ourselves is what autonomy means, or to make decisions for ourselves. A dentist has a duty to respect the patient's rights to self-determination and confidentiality. So let's look at the confidentiality part of it. Let's say that you're working in a practice for 20 years and you know your patients really well, and the dentist comes in and the one person in a married couple says, my health history update is I've been diagnosed with cancer. However, I don't want my spouse to know. So legally, the dentist is bound by confidentiality that they are not allowed to tell the spouse, even if it is a family member of theirs or a friend of theirs. Now, it may conflict with their moral feelings, feeling that the spouse should know about the cancer treatment, but the legal obligations have to trump your moral obligations in those senses, because we have to protect patients' confidentiality, not only as a principle of self-governance, but also because of HIPAA laws. Patients have the right to determine things for themselves. So we cannot try to sway people into other treatment. We just need to keep them in the bounds of the accepted treatment. So according to what the patient desires. So if the dentist has said, okay, we have 2 courses of action that we can take. Number 1 is the optimal course. Number 2 is the subpar course, but they both will be sufficient. Even if the patient chooses option 2, which is not the dentist's favorite option, we still have to respect their choice and give them the treatment within the legal bounds. Section 2 is the principle of non-malfeasance, which means to do no harm. So the dentist has the duty to refrain from harming the patient. So the dentist's primary obligations include keeping knowledge and skills current so that they are using the most current and timely techniques for their patients and knowing their limitations. So if a patient, let's say, comes in that needs an extraction, and yes, the dentist does extractions. However, this one is more difficult and they know that they're going to have issues with this tooth. They should then send that patient to the oral surgeon, who is the specialist for taking that tooth out, so that there will be less complications or chance of complications for the patient. So it's important to know when to refer to patients to a specialist for providers, or if they need to go to another professional. Say a patient comes in with an eating disorder, then the doctor is going to have to follow them through that course of treatment as psychological support, but they will also need to make sure that they're not crossing any boundaries. In section 3, we have the principle of beneficence, or to do good. So the dentist has a duty to promote the patient's welfare. Their primary obligation in service to the patient and public at large. So the most important aspect of this obligation is the competent and timely delivery of dental care within the bounds of clinical circumstances presented by the patient, with due consideration given to the needs, desires, and values of the patient. So it doesn't matter if the dentist is engaged with fee-for-service, managed care, or other practice arrangements. They have to treat all of their patients the same with this beneficence, or to do good. And that doesn't excuse dentists from their ethical duty to put the patient's welfare first. Principle 4 is justice, or fairness. The dentist has a duty to treat people fairly. So this principle expresses the concept that professionals have a duty to be fair in their dealings with patients, colleagues, and society. So the dentist's primary obligations include dealing with people justly and delivering dental care without prejudice. In its broadest sense, this principle expresses the concept that the dental profession should actively seek allies throughout society on specific activities that will help improve access to care for all. And so what they mean by that is like doing charitable work. So if there's a sealant program in your city or your county, or a dental hygiene program that goes to the schools and cleans kids' teeth and puts sealants on their teeth, the dentist could volunteer to work in that program, and that would be part of like community service and treating everyone fairly so that everyone has access to the same standard of dental care. And in section 5, the principle of veracity, or truthfulness. So the dentist has a duty to communicate truthfully. They have to be honest and trustworthy in their dealings with people. They're respected, they're professionals. People are expecting them to give them their guidance that they need, and they need to be truthful in this guidance. And that includes respecting the position of trust inherent in the patient-dentist relationship, communicating truthfully without deception, and maintaining intellectual integrity. So you can't like keep things from patients because you think that they might not be able to handle it well or something like that. You have to be able to talk to your patients and help them to understand the problems that they have and how to resolve those problems. And you have to do that truthfully when you're making these communications. Legal standards. So in addition to the ethical standards, like I said, there are legal standards established by society to regulate all of its members, and legal standards are expressed as laws and regulations. They're enacted by legislators and ruled by boards and commissions. The profession of dentistry is regulated and controlled by an individual state dental practice act. So each state enacts a Dental Practice Act, and that outlines the duties of the members of the profession, including dentists, hygienists, assistants, and laboratory technicians. So it's going to tell you in the State Dental Practice Act exactly what you can do under each qualification and what you may not do under those qualifications. So if you look it up on your state dental practice or your state board website, your State Dental Practice Act will be there. With licensure, it's a method that we use to identify members of a profession who meet minimum standards and are qualified to perform the duties outlined in regulations and standards or of the Dental Practice Act. And then with licensure, we have something called the Board of Examiners, and that's an agency that's been assigned the authority to issue state licenses. Once that license is issued, however, you will have to do continuing education as a requirement for license renewal. There's usually a fee that you have to pay every so many years, and then a certain amount of continuing education that is considered minimal for that license, and you have to upload proof of that when you renew your license now. So if you go to a live class and you get a certificate, make sure you maintain that certificate. And if you're doing your continuing education online, you can always download the certificates they give you, or if you create an account at dentalcare.com or colgate.com at their professional accounts, you can access free continuing education for dental providers. So if a dental auxiliary does something that they're not allowed or that's not assigned to them in the State Dental Practice Act, they're committing a criminal act. So if the dentist looks at you and says, I want you to go take this final impression, you are not allowed to take a final impression. Only the dentist is allowed to take a final impression. You are allowed to take other impressions, but not a final impression. So if the dentist asks you to take that final impression, you need to know that that is outside of your scope of practice, and pull the dentist, into a private area and let them know that you don't feel comfortable doing that duty since it is not assigned to you in your State Dental Practice Act. So with registration, it's a form of licensure that has been established by some states as a method of protecting the public. Some states mandate registration for such duties as exposing radiographs, performing intraoral tasks, and handling the expanded duties of the dental auxiliary. They must be renewed periodically through additional required training. Then there's certification. In some states, it's a condition of licensure that the dental assistant must be a certified dental assistant, or CDA. That certification is granted by the Dental Assisting National Board, or DANB. You have to qualify to take that certification. You have to be a graduate from a Commission on Dental Accreditations program or a CODA program, or must meet the work experience requirements and pass a written examination. DANB has created different pathways by which qualifications and requirements can be met, and it offers a CDA certificate as well as certification in various specialty areas. So you can become a CDA through DANB, you can become an EFTA, you can get certifications such as certified orthodontic assistant by working in an orthodontic office for 2 years with on-the-job training, and then you can take that examination for that certification. You can get certifications for pit and fissure sealants or coronal polishing, nitrous oxide monitoring. There are several different kinds of certifications that you can get through DANB. To qualify for the certification, like I said, you have to have graduated from a CODA accredited program or meet the work experience requirements and pass a written exam. So there are different pathways that you can choose to meet these requirements. You just have to look at the application and see which category you fall under at the time that you're applying. And with patients' rights, in the past 20 years, there's been numerous healthcare initiatives and professional organizations that have identified key patient rights that should be extended to medical and dental patients. So it's important to know the context of these rights as it applies to the treatment of patients in the dental practice. So like we talked about earlier, patients want and demand to be treated in a professional manner, and the following is a composite of key rights and how they may apply to dental patients. So with the patient's Bill of Rights, the patients have the right to be seen for treatment in a reasonable length of time. So what that means is it's not acceptable to have your patient waiting for several days to come in if they have a toothache. If they have an emergency, scheduling is important and it should be allowed daily. There should be time in your schedule allowed daily for emergencies. That's because the patients have a right to be seen within a reasonable length of time. Now, if they call you and they have a toothache and it's closing time, that doesn't mean that you have to stay to see that patient. That is the doctor's choice if they want to stay and have a patient come in after hours. But if they call it closing time, then it would be appropriate to see them the next business day. Now, if they call in the morning, it would not be appropriate to schedule them 3 or 4 days out. You would want to try to get them in that day. And in our schedules, we put in something that we call buffer time so that we do have time to put emergencies in our schedule, because we want to be able to alleviate the pain for them and possibly eliminate further health damage and temporize the affected tooth structure. So when patients are made to wait several weeks to months to be seen for routine preventative care, like a cleaning with a hygienist, if you can't get in with the hygienist, they're going to seek treatment elsewhere. So there's something that we call creative scheduling and working within the matrix appointment book that will help the administrative dental assistant to achieve this goal. So that they talk about the scheduling in chapter 10, but what they're really talking about here is not making patients be seen for or wait for several weeks or months to be seen for routine preventative care. If there should be in every 6 months, even if they've missed their appointment, there still should be some appointment slots open that you can put patients in that have had to reschedule their appointments. Patients also have the right to see the dentist when they receive dental treatment. So if they're scheduled with a dental hygienist and it's necessary the dentist also be available at that time to see the patient, what they have to do is notify the patient that the doctor is not in the office. After they've notified the patient, if the patient still agrees to come in, the hygienist will note any findings that they see in the patient's chart and take any needed x-rays. And then when the doctor comes back, they will review those findings and may call the patient in for another exam or an exam period and or treatment. Now, if the patient is called and the dentist is not going to be in the office, the patient should not be punished for canceling the appointment. And what I mean by that is, like written in their chart, you know, we would have a rule that if you canceled 3 appointments in less than 24 hours, you would be dismissed from the practice. Well, if you're calling them in less than 24 hours notice, you can't really enforce that rule when they have a right to see the dentist every time they come in. And if the dentist isn't going to be in the office, they don't have to come in that day. They can come in another day. Remember that a dental auxiliary, whether it is a hygienist or an assistant, cannot diagnose and treat patients. If a patient will be seen by an auxiliary without a dentist present, the procedure must be performed according to the State Dental Practice Act, and one must ask whether the patient has any questions. So let's say your patient comes in to have a temporary crown re-cemented and they're not seeing the dentist, or the dentist isn't even in the office that day. You could re-cement the temporary crown as a certified dental assistant and doing expanded functions. But you would also need to ask whether the patient had any questions prior to and after the treatment. Patients have the right to know what treatment is recommended, the cost, and what alternative options are available. So this is called informed consent. So they cannot give informed consent unless they know what treatment's recommended, the cost, and what alternative options are available. So you need to have open communication between the dentist, the dental auxiliary, and the patient so that everyone understands what needs to be done for this patient. We have to take the time to discuss and answer all questions regarding the treatment with our patients. Written plans that list each procedure and its fee must be given to the patient when we're going over informed consent. And consent forms outline the nature of the procedure, expectations, and possible complications. If all of this is not present, you do not have informed consent. So you need to have the patient know what the treatment is that's being recommended, the cost, the alternative options, the nature of the procedure, expectations, and possible complications. Patients have the right to expect that they will be safe. So they would be safe from any kind of a disease or infection because you are following proper and quality infection control procedures, because the dentist is following the guidelines and having all of the other people working in the office following the guidelines of licensure. So the dentist also has the obligation to keep patients safe by using materials and procedures that have been approved and met by industry standards. So they can't just use something because they think that it would be a good product. They have to use something that's been approved for dental treatment. Patients have the right to expect that the dental healthcare team will communicate in a way that they can understand. So yes, we have our dental language that we talk in. However, we have to be able to explain all procedures using common terminology so that the patient understands what we're saying and what is going to be done to them or what they may experience. So there are usually some scripts in the office that are developed for this sort of thing. There's visual aids and the provision of educational information that has been prepared for patients. Patients have the right to know the dentist and dental auxiliary team are licensed. So anyone working in the office should be posting their diploma, certificate, and license in easy view of the patient so that they can see what your training and background is. Now, I do always tell my students that it is important that you do not give them your license or your diploma or certificate. What you need to do is make a copy of it and let them hang that in their office. Always keep your original to yourself and keep that, in a safe spot, in a like in a safe or a fireproof envelope or something like that. So patients have the right to choose their dentist, and members of the dental profession believe that every patient has the right to choose his or her own patient. So there is a third party that may direct patients to a network of providers where the patient can choose a dentist within the network. So that means that when you have dental insurance, you're not just going to have one provider that you can go to. You will have a host of providers that's able to provide services to you. Patients have the right to expect that their medical and dental information is kept private. The dental healthcare team will follow all laws and regulations to ensure that all patients' personal information is secure. So these are the dental practice having a written policy, identify key personnel, and provide training and privacy procedures. So these are part of the HIPAA law, which is enforced, and it's very important that you are following the guidelines of HIPAA. Patients have the right to view their medical and dental information. So the dental healthcare team will grant access to patients' records and follow applicable laws and regulations. So if a patient asks to see their record, they have a right to view their record. They don't have the right to take the record because it is the doctor's notes, but they do have a right to view their record, and they do have a right to have access to their most current x-rays. So all of that has to be, there is a procedure in each office for that because we don't just hand over records. There's usually documents that need signed and permission given by the dentist before any of that happens. So make sure that you know what the policy is for giving patients their records or them viewing their medical and dental records in the office that you work in. So there are different professional organizations that you can belong to. There's the American Dental Assistants Association, and with the American Dental Assistants Association, that is a professional organization for dental assistants. So it has a variety of functions, including promoting professional growth and facilitating community involvement. So this is a great organization to get yourself involved in, and as a student, you can get a discounted membership. Some of the benefits that they provide are professional liability insurance, accidental death insurance, discounts on home study continuation courses, subscription to the Dental Assistant Journal, discounted membership dues for students, and scholarship opportunities. So I do recommend that you do check out the ADAA, or American Dental Assistants Association website. You will have to type in the American Dental Assistant Association. You'll have to type all that out. If you put in ADAA, you will not get the correct association. For the American Dental Assistants Association Principles of Professional Ethics and Code of Member Conduct, they state the same things that our main ethical principles state. So cause no harm, uphold all federal, state, local law and regulations, be truthful and honest, recognize, report signs of abuse to proper authorities, assist in informed decision-making of treatment options while respecting the rights of patients to determine the final course of treatment to be rendered, not to discriminate, to support, promote, and participate in access to care efforts through education, professional activities, and programs, to deliver optimum care, be compassionate, respectful, kind, and fair to employers, coworkers, and patients. You would want to avoid from down talking about any of your employer, workplace, or colleagues at any time through any type of communication, whether it be word, print, or electronic communication. Create and maintain a safe work environment. And to assist in conflict management when necessary to maintain harmony within the workplace and strive for self-improvement through continuing education. So that continuing education, you keep seeing that come up in this chapter, and it's very important that this continuing education is completed. And what that does is it makes sure that you stay current with all of the newest developments and that you understand the way things are done now in dentistry. You will strive for a healthy lifestyle that will prevent physical or mental impairment caused by any type of illness and refrain from substance abuse and never misrepresent professional credentials or education. So they have the Code of Member Conduct next, and this is the pledge. It says, as a member of the American Dental Assistants Association, I pledge to abide by the bylaws of the association, maintain loyalty to the association, pursue the objectives of the association, hold in confidence the information entrusted to me by the association, serve all members of the association in an impartial manner, maintain respect for the members of the employees of the association, exercise and insist on sound business principles in the conduct of the affairs of the association, use legal and ethical means, issue no false or misleading statements, refrain from disseminating malicious information concerning the association or any member or employee of the American Dental Assistants Association. They always need to maintain high standards of personal conduct and integrity, cooperate in a reasonable and proper manner with staff and members, accept no personal compensation from fellow members except for what is approved by the association, and to assure public confidence in the integrity and service of the association. Promote and maintain the highest standards of performance and service to the association. So that is rather detailed of what they expect of the members of the American Dental Assistants Association. And then they have HOSA on here, which is a student organization that's endorsed by the United States Department of Education. Its mission is to empower members to become leaders in the global health community through education, collaboration, and excellence. And that is the end of this chapter. Thank you.